I'm Ruby Grant. I'm a research fellow at the Australian Research Centre in Sex, Health and Society at La Trobe University in Melbourne. I'm a researcher with expertise around LGBTIQ health and wellbeing, and I've done a lot of studies around LGBTIQ health and communities here in Tasmania. I'm really passionate about working on projects that help us to understand our communities better and to address some of the challenges that we still face. I've had the pleasure of working on a number of projects that have touched on the issue of conversion practices and the ongoing harm that we see that they do in our communities. So I worked on the Telling Us the Story report, which is the largest ever social survey conducted in Tasmania, looking at Tasmanian LGBTIQ communities, funded by the Tasmanian government. And that's a survey that's been really instrumental in starting to build Tasmania's LGBTIQ policy and action plan, which was really great. And so that survey was a major survey that looked at a lot of different experiences that LGBTIQ people have in Tasmania of health, well-being, experiences at work, at school, and interactions with police and emergency services as well. We included some questions in that to explore conversion practices specifically in terms of the impact that they have on our communities. And yeah, found some really important outcomes, I guess, in terms of the impacts that they're having and the prevalence of those still today. Our research shows that conversion practices are unfortunately still quite prevalent. But really importantly, the underlying ideology that kind of underpins in conversion practices is incredibly common, prevalent, well understood. So ideas that your sexuality or gender should or can be changed through or healed, fixed through therapy and other kinds of practices, those are incredibly common. And our survey, the Telling Us the Story report survey on Tasmanians, found that 97% of Tasmanians surveyed had experienced or were aware of these kinds of ideologies, these ideas around conversion in our communities. So the majority of people are aware of this. We do see in our communities, the Telling Us the Story report, we found that about 5%, so 1 in 20 LGBTIQ Tasmanians had actually undergone some kind of formal conversion practice. This is quite similar to national surveys that show a similar sort of 4 or 5% of the LGBTIQ population are experiencing this. The writing themselves in for survey, which is a national survey of LGBTIQ young people aged 14 to 21, conducted by my colleagues at La Trobe University, found that around just over 5% of LGBTIQ young people had experienced conversion practices. And of that 5%, over half of those had experienced these practices in the last 12 months. So this is very recent, something that is still happening to quite a lot of people in our communities, and we need to understand more about the impacts of this. We know that conversion practices do considerable harm to LGBTIQ people. In the Telling Us the Story report, we found that those who had experienced conversion practices were much more likely than those who hadn't to feel unsafe in public, to say that they were very unhappy, to have experienced various kinds of abuse, including violence, abuse at school and discrimination and exclusion from school activities like school sports and other events. And they were particularly much more likely to still say that they feel uncomfortable being LGBTIQ. On a national level, we see that LGBTIQ people who've undergone conversion practices are much more likely to be diagnosed with mental health conditions, particularly PTSD. They're 4 times more likely than those who haven't undergone conversion to attempt suicide or to experience suicidal ideation. So incredible harms are done to LGBTIQ people through conversion practices, which really shows the need to address these and to prevent them from happening into the future. Ending conversion practices will stop the infliction of mental suffering on a significant number of Tasmanians. It will definitely, like, literally save people's lives. And really importantly, putting a ban on conversion practices will also help to address that really a common ideology that underpins those practices, that being LGBTIQ is deficient in some way, is still something that should be fixed or changed or isn't normal. By banning those practices, we really send a strong message that that's not okay, that people are fine just as they are, and we don't need to be forced to change. It will also have incredible economic benefits. Some studies have shown that the cost of LGBTIQ people's mental ill health to the nation is quite significant. I mean, one report in Victoria showed that even just in 2019 alone, the cost of LGBTIQ mental ill health to the state was over $3 billion just in 1 year, and that's in one state. So we really see there are significant economic benefits in terms of taking the strain off health systems as well.